I'm going to show you this S1 transforaminal neuroplasty. This is a case of bilateral S1 transforaminal. Patient is having alpha S1 minor herniation, which was on the right side, but patient is also having some, uh, when we are raising the left on the left side, he was getting pain on the right side. So this happens at times because of this severe swelling of the nerve roots. Uh, we have the cross SLR positive. So in that case, it is always better to do bilateral rather than doing unilateral. So because we have some inflammation which goes to the other side, especially the dural inflammation that causes stretching and that causes cross SLR to be positive. So that's why we also did this. Uh, in this case, we did a bilateral S1 transforaminal. Now look at this. If you we have seen people struggling with the S1 transforaminal at times because of the position. So in this patient also we can see here the foramen. We can see visualize the foramen, but it's not very clear. We know that we have the ventral foramen and the dorsal foramen, and we have to overlap both by craniocaudal tilt. But even with the extreme craniocaudal tilt, at times we're not able to overlap both of them together. And in that case, we see the struggling, people keep struggling. So this is what we see the foramen, but that is not actually our target because this what we are seeing overlapping is mainly the part of the ventral foramen. If you target this, we must remember that if you target this, we are going to hit the nerve root because this is more of the part of the anterior or the ventral foramen. So we always target the superior part of the foramen. So if you can see this, you can see over here there is another lighter shadow. So this is a dorsal foramen. On this side also you can see there's a lighter shadow over here. So in this case, again, what we'll do is we'll not target the foramen here. We'll hit the pedicle over here on both the sides, and then we'll walk off. So I'm just going to show you this technique. So don't worry if you are not able to overlap. This is the best method to do it. Look at this. So these are the foramens. And now you can see this. I'm going to hit the bone over there before going. Now we're just walking off. Similarly, on the other side also, I'm hitting the pedicle, walking off the bone and entering the dorsal foramen. Now we see later in the lateral view. In the lateral view, as you know that we have this sacral canal. There's another mistake people do is that they target the sacral canal, which is not correct. Sacral canal is in the center, in the mid line, right? We are going to on the lateral part. That is, we are going to the foramen, S1 foramen, and our target is again not S1 foramen. Our target is S1 canal. So S1 canal is somewhere here. This is the area of the S1 canal, right? So what we have to do is we have to go advance and we have to reach here. So somewhere just a rough guidance is that the posterior one third of this vertebral body is your S1 canal. So S1 enters like this, goes into the S1 canal, comes out of this S1 canal, enters into the S1 foramen between the dorsal and the ventral foramen, and then exit through the ventral foramen. So that is our target. We will go and reach the S1 canal. Look at this. So this is one side, other side. We reach almost. Now you can see the contrast has gone upwards over here. Obviously, because this is a completely open foramen, so we'll see that some contrast is coming out of the ventral foramen too. But what is our target is that contrast has gone upwards. Now look at this again. I'll show you once again. If you look at this clearly, this is one side, and now we have this contrast on the other side. So both the sides we have compared that first after injecting the first contrast, we saw some contrast going upward. After injecting the other side, we saw more contrast going to the upper part. And now we'll check AP. In the AP, we'll confirm that we are exactly covering our nerve roots. Now look at this. This is an foramen from the ventral, from the dorsal foramen. We have entered inside, and this we can see that along the nerve roots, we can see that contrast going. And this is somewhere here is the DRG. Now look at this here. You can clearly see this DRG over here. So remember this, the DRG of the S1 is quite high in somewhere at the disc level. So that is also we must understand. Some people do it go into the S1 foramen and they try to do PRF or the PRF DRG of the S1 foramen, which is wrong. DRG of S1 is somewhere here, not into the canal, not into the foramen. So this is after injecting the medication, and you can see the contrast is washing out.